So the over-the-counter medication, right, is a part of pharmacology, and this PowerPoint basically contain over-the-counter medication list, their side effect, their medical use. And also the second part contain about herbals and dietary supplement, herbal and dietary supplement. So over-the-counter medication, right? So over-the-counter medication basically shortly called OTC. NCLEX board sometimes just use OTC. But that times if you do not know what OTC stand for, it would be make a big problem. So over-the-counter medication is also known as OTC or non-prescribed drugs or medicine. So OTC we call about non-prescribed drugs or medicine. All this term basically refer to medicine that you can buy without a prescription, right? You do not need the prescription to buy. So if you go in any CVS, Walmart, or Tesco, you can buy it without a doctor prescription. And most of them are safe and effective when you follow the direction on the level and as direction by your healthcare profession, anyone, right? So here I said, so used over the counter or OCT, we used for short-term treatment of any common minor illness like sneezing, allergic rhinitis, right? Mild fever, mild pain. So this figure 300,000 OCT drugs are available in US market. OTC drugs review for safety, for efficacy. Efficacy means the effectiveness on the disease in human body. Appropriate labeling is okay or not, is it standard, it is safe, and also reclassification. Some are for gastric, some are for dental, some are only for skin, or some of only for the bowel, constipation or diarrhea, some are for eye, some only for ear, right? Classification. So the most common example over the counter drugs basically we most use for, like, most popular example include the pain reliever. If you go, most selling drugs are pain reliever like acetaminophen or Tylenol, ibuprofen, it is called Advil or Morphine, cough suppressants such as dextromethorphan or antihistamine like loratadine. So this is the most common selling OTC, over-the-counter drugs, selling drugs. So in this table, what they said, the criteria for what? Criteria for over-the-counter status, indication of the use. So indication for why or when we use, for diagnostic condition or when you monitoring the effectiveness. Safety profile like favorable adverse effect profile, limited interaction with the other drugs, low potential for abuse, and also high therapeutic index. Safety profile, and also practically for over the counter use, basically easy to use and easy to monitoring. Or this type this type of drug medication has no or very less side effect. So here in this picture or table, you can see what are the information basically labeling in OCT. In this PowerPoint, we are going to discuss about what are the most common OTC drugs and can anyone sell over the counter drugs, or how how do drugs become more over the counter? Hmm? So basically, when you buy any medication over the counter, you have to read the information, basic information about medication. Hmm? Example here, the drugs here is active ingredient like antihistamine. It is called chlorpheniramine. This is the in chemical name. Basically, antihistamine for flu, sneezing, nasal discharge, fever, we use antihistamine. Also, if we go and read, you can see the indication of medication or uses, when or what medical condition we use it, like allergic reaction, sneezing, runny nose, itching, watery eye, and itching throat. This is the indication of antihistamine. Chemical name is chlorpheniramine. But always every drugs has some of the common side effect. They are not measured, but you have to be aware about that. Hmm? Or if you have any medical condition, it is good, it is safe if you ask your doctor. So when you need to ask a doctor before to use this antihistamine, like if you have a glaucoma or you have a breathing problem such as emphysema or chronic bronchitis, right? Also ask a doctor or pharmacist before use if you are taking tranquilizer or benzodiazepam or in sedative. So tranquilizer or benzodiazepam or sedative with antihistamine is not a good choice. Because both have a side effect of sedation, dizziness, confusion. If you take these two medications together and then you drive the car, what will be happened? If after it taking you drug, if you go for your heavy machinery operation, right? Dangerous work is not good. So you have to tell your patient before use this medicine. So when using this product, when using this product, what are the effect causes? Like drowsiness, or you have to avoid alcohol with antihistamine, avoid alcohol, sedatives, tranquilizer, all causes or increased drowsiness. And be careful when driving a motor vehicles or operating heavy machinery. Also, excitability may occur, especially in the children. Hmm? If you are pregnant, definitely if you are female, pregnant or breastfeeding, you have to talk to your healthcare provider before use this medication. As usually makes sense, all medicine keep out of reach of the children because children are very curious. Whatever they get, they like to put inside their mouth, and it can cause very dangerous overdose effect or toxicity. In case of overdose, get medication help to contact a poison control center to contact. Also, in the labeling, they wrote the direction of medicine or medication, direction of use. Like adult or children, 12s or over, take 2 tablets every 4 to 6 hours. Hmm? In case of the children 6 years or under 12 years, take 1 tablet every 4 to 6 hours, not more than 6 tabs in within 24 hours. So children under the 6 years always talk to a healthcare provider. So this is the very basic information labeling on the drugs, antihistamine, right? When you buy, you have to read it. Before to buy, you better to read and then buy. So here the mentioning the classification of medication we use over the counter, like ibuprofen, Advil, or naproxen. These two are pain reliever, right? Other pain reliever we use or we buy is called acetaminophen or Tylenol. Then diphenhydramine. Diphenhydramine we use for sneezing, itching, runny nose, right? Also, sometimes we use for motion sickness. Basically, for motion sickness, we use diphenhydramine or Benadryl. Loratadine. Loratadine is called cletrin cetirizine. Loratadine. It is also antihistamine. Antihistamine. Or we use other medication for cough and cold medication, dextromethorphan, omeprazole or famotidine, most popular drugs for peptic ulcer disease, most common for peptic ulcer disease, right? So here, paracetamol, some country it is most important, or I said the acetaminophen or Tylenol. When you buy, it is very important. We have to know. Over-the-counter painkiller available from pharmacy, such as ibuprofen or acetaminophen or paracetamol, Tylenol, can relieve acute pain. Their effectiveness will depend on the things like the type and severity of the pain and the dose of medication. What next? A question. OTC, over-the-counter medication, now count for about what percentage of all medication used in United States? So this is the information you are going to learn from the classroom. Then you can apply during the exam time. So over-the-counter medication around 60% cover, right? Answer is the D, 60% of all medication used in United States over the counter. So what are the, when you use the OTC drugs, what are the potential hazard, right? So what are the potential hazard or side effect? So, or is it safe to use? It is very common question come. Or is it safer? So most postpone effective treatment of more chronic disease state, or may delay the treatment of serious or life-threatening disorder, or may relieve the symptom for a disorder but not the cause. So what you understand from here? What are the potential hazard? Definitely nobody want to go to the doctor office unless they are not seriously sick. Who want to go? Nobody, right? Nobody like to meet with the doctor office. So I said here, sometimes we use the over-the-counter medication and we delay to go to the doctor office. When we do not go, because the signs symptoms of the diseases disappear for a time, but over-the-counter medication do not remove the underlying cause of the disease, underlying problem. So it is not curable. Just some symptom is disappear for a time being, right? So in that point of view, it is not a curable medicine. Sometimes it is delay the treatment of chronic disease or life-threatening diagnosis not help to find out. May postpone the effective treatment. Like if you have a pain, maybe you have to go to the doctor office and find out why I have a pain. But when you go and and get the medication from over the counter, you take it, pain disappear. So you postpone the doctor appointment. So toxicity, sometime, yeah. Like if you take the acetaminophen overdose, they cause liver toxicity. This is not good for the liver, right? Or interact with current prescription medication may occur, and definitely abuse. Example, antihistamine we take for sneezing, itching, runny nose, or flu-like sign symptom. But this medication has a side effect, it's sedation. Some people take this medicine for a sedative or for the sleep. Definitely it is the abuse of medicine. Like the tranquilizer we use for anxiety, but tranquilizer can cause sedation. But somebody use this medicine for sleep, and this is abuse. What next? A question here. A 56-year-old man is taking over-the-counter antacid for relief of indigestion. Antacid. He tells the nurse that he consumed at least one bottle a week. Oh my God, it's too much, right? And has done so for over a month because it works for me. So he's a doctor by himself without any certificate, right? So no need the licensing exam. So it works for me. So the nurse main concern about what? So this self-treatment is expensive. This self-treatment maybe delay the treatment of a more serious problem. This self-treatment may be best treatment of the indigestion, and long-term use of antacid may take the indigestion worse. Out of 4, at least we can find out A and C is not an answer. And B and D is a possible of the answer. So out of 4, at least you can make it short, only 2. Now you think which one. Number B is they said this self-treatment maybe delay the treatment. Yes, it is good opinion, option. And D, the long-term use of antacid may make a indigestion worse. Both, but which is the most dangerous or most priorities, right? So they said that what are the answer? B. But in that case, let me read the question again. If 56-year-old man is taking over-the-counter antacid for a relief of indigestion, and he tells the nurse that he consumes at least one bottle a week and has done so far over a month because it works for me. The nurse's main concern is that its self-treatment may be delay the treatment of a more serious problem, right? This is the answer. And I said A and C is not an answer. Answer might be B or D. Then we have to find out which one is the most important. Delay the treatment and long-term use of antacid may make the indigestion worse. Yeah, it is one, but delay the treatment is the more serious problem. It can make more serious problem. Maybe the peptic ulcer lead to the carcinoma of the stomach, right? In that point of view, answer is B. B is the most important to give a concern. It make more indigestion worse. It's okay, indigestion is worse. But if it is making another disease, more dangerous disease, serious problem, that is the biggest problem. So answer is B, they said. So explanation. Over-the-counter medication should be used only for a short-term treatment of common minor illness. And this use may postpone effective management of the chronic disease, right? And may delay the treatment option. The nurse-associated use of which over-the-counter medication with the development of hepatotoxicity. So out of all, which one is most commonly used and causes the hepatotoxicity? The nurse-associated use of which over-the-counter medication with development of means they causes the liver problem. Which one? Acetylcysteine acid. Is it aspirin? Aspirin, but chemical name is acetylsalicylic acid. Aspirin we use for pain. Aspirin we use for fever. Aspirin we use for heart problem, right? They has a properties to protect your heart. Chemical name is called acetyl salicylic acid, very important for NCLEX board. Ibuprofen, it is called Morphil. The ibuprofen has a action to reduce the pain, action to reduce the fever and inflammation. They reduce inflammation as well. Other medication most commonly used is called acetaminophen. Acetaminophen has a anti-fever or pyretic effect. They have a use as a painkiller, right? Also little bit anti-inflammatory effect. The most common, everybody know, is called Tylenol. So acetaminophen toxicity most common, and they are hepatotoxic. Like if your baby went for the vaccination today, and if any baby go for vaccination, they have a side effect of locally pain, increase the temperature. Don't give them any medication from over the counter. Better to talk to the healthcare provider. So if anybody has to take acetaminophen over too much and they cause overdose and causes the liver toxicity. Answer is D. Now we are going to talk about the herbal or dietary supplement, right? So sometime NCLEX board asks the question to ask about the herbal medication or herbal medicine, right? So herbal medicine or herbs, sometimes we ask them alternative medicine, right? Alternative medicine. So dietary supplement, three terminology here: dietary supplement, herbs, and herbal medicine. So dietary supplement means orally administered alternative medicine, including herbal supplement. Then herbs means plants component, including berries, root, leaves, seed, flower, whole, natural source. And herbal medicine, it is the study of pharmacology or the use of medical plants, and these plants have used to basics of medical treatment through most of human history. And such traditional medicine is still widely practical or practiced today. So when herbs or different plants origin we use in medical field for the treatment of the disease, this is called herbal medicine, right? Sometimes the herbs or herbal medicine we called complementary alternative medication or medicine. So what else? What are the use? Therapeutic agents for the treatment and cure of the disease. Prophylactic agents we use as a prophylactic. Before disease we use it to prevent the disease. Prophylactic use for long-term prevention. Therapeutic use for the treatment of cure of the disease. So if the acute condition attack the disease and you use this one and you feel good, therapeutic. But if you use before, like flu vaccine, we use before flu attack. So it is a prophylaxis. Like a patient has a HIV and you give them anti-TB medication or any vaccination. So it is protect them to attack the disease. It's prophylactic use. Proactive agents to maintain the health and willingness and boost up the immune system. Somebody believe it about the herbals, like Chinese medicine, right? What are the most common use of herbals medicine or alternative medicine? Like we use them for anxiety, we use them for cold and cough, for depression, headache, insomnia, ulcer. PMS means stand for premenstrual syndrome, arthritis, constipation, fever, infection, stress, and weakness, right? So this is the common use. This is the common use, I said. Definitely when you go, the particular medication we use for particular problem, right? As an example, I said, like here, example, St. John wort. St. John wort we use for wound healing, or we use for premenstrual syndrome, or for the depression, right? Another example I want to give you, like ginger, we use for reduce the morning sickness, nausea, or any use for the treatment of burn. Ginger. Like garlic, we use for decrease the cholesterol, right? So saw palmetto, we use to the increase the health of prostate and also increase the urine flow rate. So different herbals we use for different purpose. Here showing some of the example or commonly used herbal product or herbs. Example like here, aloe vera, right? Then feverfew. Aloe vera, basically they have a anti-inflammatory properties for burn, for abrasion, and also aloe vera basically helps for or with the tissue injuries, right? Another one is called ginkgo biloba. Ginkgo biloba improve the blood circulation. These are the herbs we use and increase the blood circulation, I said. Also, they improve or alteration of pain, increase to the concentration. But ginkgo biloba, you have to use at least 6 to 8 weeks to see the result. Like St. John's wort, frequently asking NCLEX board exam, St. John's wort reduce the morning sickness or wound healing, I said, or they have a diuretics property. Also, we use for depression, right? Another one is called echinacea. You see the spelling, echinacea? Echinacea basically blood purifier. So blood purifier, they fight against the cold or infection and even cancer. The most popular, everybody know, this is called garlic, right? So the garlic, we use the as a species in our cooking food during the cook. Garlic may decrease the cholesterol, decrease the blood pressure or glucose level. The garlic have antibacterial and antifungal properties. And also they improve the circulation. Another most popular medication in China, this called ginseng, is very expensive. So the ginseng, it is the ginseng. Ginseng we use for anemia, for hypertension, or benign prostatic hypertrophy. Benign prostatic hypertrophy, ginseng. Saw palmetto. Saw palmetto we use for hair loss or support the health of prostate, like ginseng also improve the urine flow. They are the name of the most common herbs or herbal medication. In these boxes, basically help you to understand more and also help to answering the question in NCLEX board, right? So here you can get the name of the herbal medicine or medication name list, and here you can get the medical implication or indication. Like aloe vera, we use if injected. Okay, so here I said aloe vera anti-inflammatory effect, help with the tissue injuries, but it is very important what NCLEX would ask, if your patient has to take the digoxin for heart problem, it is not good to take these two together because aloe vera may increase the digoxin level, and you know digoxin level if increase causes the digoxin toxicity, right? Another one is called echinacea, blood purifier. They are contraindicated if the mother give the breastfeed. So breastfeeding women are not allowed to take echinacea, right? Even then it is not good to give if anybody are immunocompromised. Who are immunocompromised? If the patient have a HIV or cancer under chemotherapy, right? Organ transplant, they are immunocompromised, immunosuppressed. They easily get attacked by infection. If patient have infection, how you understand? Increase the body temperature. right? Fever. Ginseng used for hypertension or benign enlargement of prostate or anemia. So when you give the ginseng, you have to follow some precaution, okay? And what it is. So caution with hypertension or diabetic or clotting disorder. Avoid with coumadin. So if your patient has to take the blood thinner, warfarin, heparin, or coumadin, not to give ginseng and blood thinner together. Why? Because ginseng increase the effectiveness of anticoagulant, so bleeding tendency increase. If your patient have a selective for surgical operation, at least 7 days before, you have to hold the ginseng. Another one most commonly asked in NCLEX board, St. John's wort, right? St. John's wort sometimes we use for a wound healer or premenstrual syndrome to reduce, or diuretics, and also can use antidepressant. But it is very important, if your patient has to take St. John to wort, tell them not to go under the sun because they cause photosensitivities. Avoid the sunlight. Antidepressant and St. John's wort never ever together, right? Also avoid with hypertension or immunocompromised patient. Avoid the food containing the thiamine, right? So as I told you, the ginseng, the St. John's wort also alter the function of coumadin. They decrease the effect of coumadin, right? So another point we have to know for the board exam, if the patient has to take the St. John's wort, better to avoid the food that contain the thiamine. So what are the example of the food or food list contain the thiamine? Like aged chicken liver or aged cheese or beer, right? They contain the thiamine. What else? Red wine or soy sauce, right? And even some seafood sauces, they contain the thiamine. So thiamine containing food and St. John's wort not together. Another herbs is called kaba kaba, right? Kaba kaba decrease the anxiety and stress, right? But kaba kaba increase the effect of barbiturate. Barbiturate is a diazepam or tranquilizer we use for anxiety, right? So kaba kaba and barbiturate not together. Ginkgo biloba. Ginkgo biloba we use to improve the blood circulation, improve attention span, or takes 6 to 8 weeks to see the result if anybody take it. Very important note you have to know, So if the lady are pregnant, it is not to give them. So contraindication of ginkgo biloba in the pregnant women or pregnant uh, or breastfeeding mother, that contraindication. Also avoid coumadin. Why? Because ginkgo biloba increase the effect of coumadin and they increase the bleeding tendency. If your patient are psychiatric and take the monoamine oxide inhibitor, right? Monoamine oxide inhibitor. So it is not too good not to give together. It is not to give them who take the monoamine oxide inhibitor. Also, patients should avoid the dilantin. So if your patient has to go for any kind of surgical operation, it is good to hold it for 36 hours before surgery. Another one is called ginger. Ginger reduces the morning sickness, nausea, and used to treat the burn, right? So they may cause central nervous system depression. They may cause cardiac arrhythmia. So if you give, it is good to check the pulse rate, heart rate, because cardiac arrhythmia lead to dysarrhythmia and dysarrhythmia lead to heart failure. They're contraindicated with gallstone disease. So if anybody has a cholelithiasis, cholecystitis, it is good not to give them. Ginger may increase the bleeding with coumadin, right? So ginger, ginkgo biloba, saw palmetto, and ginseng, all of them interact with blood thinner. So they are not good to give with coumadin, warfarin, or with heparin. But aloe vera can interact with the digoxin, right? Or digitalis. What else? So another one is called ginger, right? Ginger reduce the, I believe I could finish it. Now garlic. So garlic may decrease the cholesterol or blood pressure, blood glucose level. They have antibacterial properties. They have antifungal properties. And they also improve the circulation. But what we have to know? Garlic may affect the blood clotting or blood sugar. Also avoid diabetic mellitus patients. So if your patient have a diabetic already, it is good not to give them. And they also causes or interact with the blood thinner like ginger or other herbal medication they cause. So let me go through again here. So saw palmetto, right? Other one. Saw palmetto support health or prostate and improve the urine flow. They have anti-inflammatory properties, right? Anti-inflammatory, and also prevent hair loss. They may cause stomach upset means may cause nausea, vomiting, or diarrhea. Another most important one is called Valerian rot. So they cleanse the nervous system or promote the sleep. Also, they used to for headache, anxiety, or nervousness, right? If I ask which herbals we can use for insomnia or sleep disorder, it is valerian root because they promote sleep, right? If I said which herbals we use for arthritis, feverfew, right? So they valerian root may increase the sedation when used with ethyl alcohol. So alcohol with herbals, especially valerian root, not together. Barbiturate, tranquilizer, not with valerian root, right? Muscle relaxant, not with valerian root. So even sleeping pill, not with them, because both increase the sleep, patient goes sedation. Black horse, another herbal medication used for menstrual or menopausal syndrome, menopause. Used for the sedation and diuretics and reduce blood pressure, hot flush, night sweat, and mood changes, right? So when you give the medication for black horse, or if you know your patient has to take the black horse, you have to inform healthcare provider, right? Overdose may cause GI upset like nausea, headache, dizziness, tremor, or reduce the heart failure. What are the contraindication of black horse? If your patient has a chronic heart failure, or if your patient are pregnant or giving the breastfeed, they are contraindicated. Even if your patient has to take the oral contraceptive method or hormone replacement therapy, cardiac medication, they are not ideal candidate for these herbs. Black horse, not good to use. Last two herbals are called feverfew. Feverfew used for migraine headache or joint pain like arthritis. So same like other herbals, ginger, garlic, saw palmetto, or St. John's wort, they can interact with blood thinner. So increase the effect of coumadin and increase the bleeding. So it is good not to give with heparin, warfarin, with feverfew. Contraindication is the pregnancy. What are the other herbal is contraindicated in pregnancy? Black horse, right? So the licorice used for peptic ulcer or GERD. GERD stands for what? Gastroesophageal reflux disorder. It is the sign symptom like the peptic ulcer, or we use the licorice for duodenal ulcer, weight loss, eczema, or other sore. If your patient have a heart disease, it is good not to give licorice. They may increase blood pressure or avoid with SC inhibitor, steroid, or digoxin. What next? Next here, so Herbal and Dietary supplement. Basic information about this. So the Dietary Supplement Health and Education Act by 1994. What, according to this, what are basically important for herbal and dietary supplement? Herbal products are considered dietary supplement. Dietary supplement, right? So there are so many medication, vitamins, minerals we can buy over the counter, and it is dietary supplement, right? Dietary supplement, I said. And no proof of efficacy or safety required. So they're not harmful for your body, and also no standard for quality control. So maybe it work or may not. So also may claim effect but do not have to promise a specific cure. Do not any specific cure. What next? The other terminology we have to know or we should discuss about the alternative or complementary medicine. What it is? The alternative medicine used to use of a herbal product or other non-traditional remedies, right? Non-traditional. Sometimes we just use complementary medicine, alternative medicine. So the complementary or alternative medicine that's simultaneously used for both traditional or alternative medicine, right? So I said all herbal medicine basically alternative or complementary medicine. Medicine. So basically, at least if your patient has to take any complementary medicine or alternative medicine, you have to inform your doctor or healthcare provider about the complementary or alternative medicine, right? So some books said the complementary or alternative medicine indicate the practice such as, even I said alternative or complementary medicine included the acupuncture or drinking green tea even, or tai chi, even massage therapy. All are complementary or alternative medicine, right? So let me recap something about the alternative and complementary medicine here. What next in this PowerPoint? So here I said the alternative medicine is any practice that aims to achieve the healing effect of medicine, but which lack of biological effect or unstable or proven ineffective, right? The complementary medicine, or also called complementary and alternative medicine, shortly called CAM, or sometimes called integrated medicine, or integrated or integrative, or sometimes called holistic medicine, right? Holistic medicine here. Now we go and check one question about here, what it is. Okay, let me read the question. A patient tells the nurse that he wants to stop taking his antilipidemic drugs and start taking the garlic to lower his cholesterol. So what are the nurse's best response? Number one, that decision is up to you. Number B, you have every right to switch the herbal. Number C, you should not go against what the doctor prescribed for you. And number D, let's explore the evidence that support the use of garlic to lower your cholesterol level, right? So number D is very logical explanation. If scientifically proven or any clue, that definitely we do not have any problem to take alternative therapies, right? Alternative therapy share in a common that they reside outside medical science, right? Or sometimes it's called the pseudoscience, traditional practice. Traditional practice become alternative when used outside their original setting without any proper scientific explanation or evidence. So frequently used, the term for alternative are new age or pseudo, right? So if any situation like this question, it is better to explain, or if patient have any clue, tell them, verbalized their feelings. What are the rationale? The nurse can provide patient education regarding potential risks and adverse drug reaction that are possible with herbal product. Now go little bit talk about the implementation, nursing implementation, obtained through the medical history, documentation, all medication used, even OTC, herbs, vitamin, minerals, or other supplementary. Assess the level of education and understanding. Assess for information the specific to various product. Here we go. When we take a medical history from the patient, we has to take the medication history or drug history past, allergic reaction, what are the current medication he or she takes. We have to include it in our history. If need, we have to inform healthcare provider. So level of education or level of understanding, very important for communication and also print the message to the patient, carry the message to the patient, print the information in their brain. If they're educated, it would be easy to catch the information, right? Assess the information specific or various product. If they buy, they has to read, and also they can search from the Google, right? Everything in your hand. Assess the system function, especially renal, liver, or cardiac. So if what herbals you are taking, what are the bad effect of that herbal over the kidney? Is it renal toxicity, nephrotoxicity? Is it hepatotoxicity, or any bad effect over the heart? You have to know. If you know, you have to inform your patient because you are concerned about their health. Also assess for conditions that are contraindicated. So if the mother is lactating, breastfeeding, is not to take herbal medication, right? Assess for the potential drugs or drugs herbals interaction. Some of the drugs when interact increase the efficacy. Some of the drugs when interact decrease the efficacy. So if you do not know how you have to reinforce your patient, provide thorough or individualized patient education, one-to-one, even sometimes demonstrate remodeling. Tell them what you explain, what you educate, tell them to redo it, demonstrate it. Also encouraging the patient to recognize that manufacture of herbal product, right? And dietary supplement are not required to probe the safety or effectiveness. Herbal product may not be safe for the pregnant mother or breastfeeding women. Not good for infant or children's, right? So if you know the side effect of herbal product or alternative medicine or complementary medicine or integrated medicine, tell them not to take, because some traditional ethical system, they prefer their traditional medicine. They don't like to hear the doctors. They don't like to hear the scientific journal. They like their Ayurveda medicine, right? They like their traditional Chinese medicine. Because traditional medicine also is considered alternative medicine. So natural dose not mean safe because it is not scientific. They do not know what are the bad. They do not know basically what they do not know. Or they do not know what they should know. They like to preserve their tradition. They're conservative about their things. Teach the patient to monitor themselves for unusual or adverse reaction, right? So as a RN or LPN, it is our responsibilities to inform our healthcare provider if we know our patient taking the herbal medicine, because herbal medicine can interact with other medication or pharmaceutical medicine.